Ladies and gentlemen, now we move on to our next session of the day. Food safety and quality control, the microbiological aspects and predictive approach. A very unique topic once again. And to present this topic, I would like to call on stage with a big round of applause, Mr. Naresh Kumar, Application Support Manager from bioMérieux, South Asia. A big round of applause to Naresh ji. Naresh ji, welcome to the stage and looking forward to a cracking session from you.
So, good morning. So yes, I think we are a little bit late, and I'll just discuss about the microbiology and starting with the brief introduction about the company. So we say we are following Passion footsteps because Mr. Mahipalpur, who was the founder of the company, was co-worker and student of Mr. Louis Pasteur. So back in 1897, he started work in the field of microbiology and working on vaccines initially. And then in 1963, the grandson of Mr. Mahipalpur, Mr. bioMérieux, founded bioMérieux. And they moved into the IVD business. So now we are here from last 60 years serving public health aspects by providing the IVD solutions. So we have two verticals. One is catering to clinical aspects, and second is industrial applications, where we cater to the pharmaceutical, food and healthcare segments. So yes, talking about food safety, we were from the morning we were discussing about it, and yes, the food fraud, adulterations, and the contaminants. Yes, it's a shared responsibility. I think there was a brief discussion on that already. And yes, it's everyone's responsibility, and we have to be aware about it. And yes, it starts from the consumer. Okay, we have to be responsible when we are taking any kind of food. So yes, when we talk about assessment of the microbiological risks, we talk about the contaminants here. So like pathogens, which can impact the health of the consumer. So here we can see 550 million people fall ill every year, okay, because of the consumption of the contaminated food products. So the burden is very, very high, and it's also impacting the economy of the countries. So here we can see some data which is from WHO, and you can see there 42 million people die every year because of the consumption of contaminated food. So you can see here, it's a very huge number, and we generally don't think like that, and when we are consuming any kind of food product, there is not much concern about the microbiological food contaminant. And also, when we talk about in India specifically, when we talk about the focus on the testing, it's more toward the analytical side. Okay, microbiology is still lagging, but it's changing now. And in last 10 years, we have seen a dramatic change when we talk about the microbiological food testing. Pharma, it's very, very stringent, but food, the diversity of the matrices is very, very huge, and the contaminants are also very, very different from the pharmaceutical products. So here is a few data from a research which was done specifically for India. Here we can see around 2,688 foodborne outbreaks were recorded in this study. And we can see here around 572 deaths were recorded during this study in the 10 years of time. So the data is limited because it's very difficult without any surveillance program in progress in India. But we can see the impact is very, very high here again. So these are the common food poisoning germs which cause the health impact on the consumer. So you can see Salmonella norovirus are on the top because most of the food poisoning cases are because of these organisms. And the testing and detection of these kind of contaminants is very, very necessary for any kind of food product. So yes, food industry is at a turning point now, and we have seen there is very much awareness about the testing part, and quality control is now evolving. The labs where they are testing raw materials, the in-process products as well as the end product, they are very cautious about microbiology as well as chemical testing. So yes, the trends are changing now, and industry is very much aware of these things. Yes, it will take time, but you can see a change, and people are coming forward and looking into the various aspects, how can we control any kind of contamination, what processes needs to be improved in the labs as well as in the manufacturing facilities. Yes, the challenges. First of all, we can say the new emerging pathogens or the organisms which can lead to the food poisoning cases. This is the major challenge, and the antibiotic resistance also, which is again a hot topic in clinical as well as in the food segment. So changes in the consumer preferences, changes in the environment, the processing, and as well as the requirement of the food in the country. Like we have to feed, the population is very high, and production needs to be improved. So the impact, you can see here, there are a few cases, and because of the outbreaks of the processed food, there is high penalty which is charged to some organizations. There is jail to a CEO because of the product there were 9 deaths. So the impact is very high, and regulatory bodies are very stringent now. In India also, the trends are changing, and they are more focused on such kind of incidents. Yes, so as I mentioned, there's a change now. In the coming 10 years, it will be more improved, and the solutions, the improvement in the food industry, the processes is taking it to another level. And the food production methods are being improved now, and we have much more efficient systems in place which can lead to the safe food. So talking about microbiology challenges. So here we know that for chemical testing, it doesn't take much time because we have many rapid solutions which give you results within 1 or 2 days. But when we talk about microbiology, the conventional testing takes around 5 to 6 days. In some parameters, it also takes around 14 days when we talk about commercial sterility. So it's a bottleneck, and you can't release your product in the market before ensuring the quality of the product. So to cater that, we have to move to the rapid solutions. And the rapid solutions which can give you quality results as well as shorten the time period of your testing. So as I mentioned, it's a shared responsibility as a food safety, and everybody has to be aware and spread the awareness about the food safety in the community also. So now we talked about the traceability and how the things are moving ahead. We can see here there are 4 pillars, and now we can see the QR codes we were talking about, the information of the products. And as you know, by sitting at home, you can order any food, okay, from an application. Similarly, in the coming time, we will have more information about any food product, any adulteration, any outbreak on our mobile phones, and the things are moving towards that side. So we provide, as I mentioned, we provide rapid solutions, and you can see here a complete testing range starting from the preparation of the media till the confirmation of results, as well as analysis of the data. So the detection, then the identification, investigations, data analysis, trend analysis, and finally genome sequencing for any kind of contaminants you are finding in your facility. So we have a complete solution, and approach is moving towards the augmented diagnostics that we can say, and before happening of any incidents, we will be able to know that yes, it's going to happen, and we can stop it from happening. We talk about healthy factory, where we have a proper process when we talk about the raw material testing, then environmental monitoring, the in-process testing, as well as end product testing. So if the FBO is following all the required guidelines which are there, so that can be that can ensure the quality of the product as well as the safety of the consumer. So augmented diagnostics, when we talk about it, there are 3 steps. One is risk assessment, which happens on the first steps, then actionable insights, what needs to be done, and finally, the safety of the consumers with the quality of the product you are selling in the market. So we talk about risk-based approach today, and previously it was detection and action, but now we are talking about prediction and reaction. So to predict any kind of quality incident before happening. So here the approach changes today, and we are providing solutions to the industries where they are using our solutions to do the risk assessment and stopping any kind of incidents, like contamination incidents happening in their product. So finally, this is something which, like a plan, where we talk about a complete solution. So on the right-hand side, you can see the predictive modeling, where we talk about the risk-based raw material testing and the environmental monitoring. Then we have solutions like EPM consultation, which gives you insights of any kind of pathogen contamination in your facility. Then we talk about the pathogen mapping, where we have softwares which can be introduced, and on the basis of genome sequencing, we can see the contamination moving from one area to the other area. So like if there is any incidence which is happening, or you're finding any kind of adverse trend in your facility, you will come to know that what is the pathogen and from where it's coming. So it's like you can take action accordingly, and you can also, with the help of software, you can also predict or also confirm that is there any kind of mutation in the contaminant which you are finding in your facility. Then we have different softwares like EnviroMap, which we are providing to our customers with the lab consultation. So a complete process starting from the prediction till the confirmation of the results. So that's all from my side. Thank you very much for your attention. If there are any questions, we can discuss now.
So, ladies and gentlemen, a big round of applause for Mr. Naresh Kumar, Application Support Manager from bioMérieux South Asia, on that wonderful presentation on food safety and quality control, microbiological aspects and predictive approach. Now, in the interest of the time, and as per the request of Nareshji, we will open the floor for questions. So please raise your hand and do introduce your organization and yourself, and I'm sure Nareshji is ready to take the questions. Also, before you start the questions, I would like to remind you, since yesterday, the entire team of bioMérieux is here. So even after this session, Nareshji and the entire team of bioMérieux South Asia is here to take your questions, your queries, and give you your unique solutions to the industry. Yes. Yes, sir.
So this rapid microbiology, how much it's successful? And from conventional method, how many days benefits we can get in advance?
So, sir, we see again talking about the success. We are very, I think, well established, and the organizations which are more quality concerns are already having our solutions. Second, the time saving. So we have solution with which you can release the product within 2 days instead of 14 days. So you are saving around 12 to 13 days, and inventory cost you are also saving on that. So the organizations like Coca-Cola, they are already using our solutions to release the product, like juice products. So within 2 days, instead of 14 days, they are sending the product into the market.
14 days for what actually?
So it's a
Actually, it should be maximum 7 days or 72 hours.
yes. So sir, it's aseptic juices which we are talking about. So they are the general processes. They incubate for 7 days. Then the plating time. So it's around 12 to 14 days. Yes.
Aseptic juice means there is no preservative at all.
Yes.
And now you have discussed this microorganism, but there is a grey area that it is not only from food. Recently, Dr. Reddy's lab has done a lot of research, and we came to know that food handlers, like we go hepatitis, everybody know hepatitis B, everybody I think vaccinated. But hepatitis A, a very potential cause for food, causing the sickness and all. And same as typhoid, which is very common in India and many cases coming through. So there is any way to, to have a detection, quick detection like that?
Yes, sir. So we have solution for
And,
that.
and do you advise that we should be vaccinated hepatitis A and typhoid? Because the typhoid, what bachpan mein hum jo liya, it has been now third genera or fourth genera some vaccine which will be, effective now because of mutation of bacteria and all. So what is your suggestion about this food handler vaccination or any advice?
So, sir, vaccination, I think we have some set guidelines for that, and time to time the regulatory bodies are also changing the guidelines for vaccinations. So, food handlers, obviously, they have to be vaccinated, and there are programs. The industries, I think FBOs are following that. And yes, if there is any change, yeah, we have to be cautious about that, and also if we are because there are forums where regulatory bodies are also discussing with the FBOs. So if, yes, they see it, there is a requirement of it, it has to be done.
So as of now, hepatitis A on this typhoid for food handler, as of now is not mentioned, is not covered by regulatory body.
Yes, but sir, I think, see again, it's a continuous process, and you see time to time new guidelines are coming in. Okay, so yes, when we send a message to the regulatory, they have to look into this. And I think there will be a change in guidelines and they will suggest to do that also. And the second question, I think regarding virus detection, yes, we have the solution. And it's a PCR-based solution and it's quick. You can do virus testing within around 2 hours of time. So we have hepatitis, norovirus detection. And even like for rapid, we talk about the pathogen when we say it's at least 24 hours with enrichment. But yes, we have quantification also now. So it's immediate. You can directly go with the sample. You can detect the salmonella directly without enrichment. So those kind of innovations are happening. And we are also looking towards the industry. Okay, what is the requirement? Whenever there is, we are open for any kind of requirement from the industry. When they are asking us, we need this thing, we are also doing the customized solution for them. So any specific pathogen or any specific organism they want to detect, we are able to create the kits for them, which works with our systems.
I mean, you say it's a qualitative, not a quantitative.
Sir, see, salmonella, we have both protocols, quantitative as well as qualitative. Because if you see recently in US, they are looking for quantification of salmonella now. Okay, it's more stringent, and I think it gives a idea about the contamination level in the product, specifically for meat and poultry. So they are doing it now, but India it's not implemented yet. I think looking towards the requirement, the regulations also change by the time.
Last question. We have taken a trial of this rapid microbiology versus conventional, and we could not come to a conclusion because there was a lot of difference, not within the acceptable range. So any advice for that?
So, sir, the whatever solutions we have the validations from AOAC as well as ISO 16140, where they look for the comparison between the reference method and the alternative method. And if it is within the range, only then they certify the solution. And also, we are following a strict industry requirements that we are verifying each and every protocol at the customer site following ISO 16140 Part 3 standard. So that gives you confidence, and also we can present that yes, the solution which we are providing is as good as the conventional method.
I used to use RedaCount in my overseas employment. RedaCount, I think you have heard, RedaCount, which is also a rapid microbiology, where we used to find the difference was acceptable range. In India, do you have like this type of anything, I mean acceptable range?
Sir, it is as per the standard guidelines from global bodies. So ISO and AOAC, there is a set acceptance criteria, and it should fall with that only. So whenever we do the verifications, we do the challenge, and we show that yes, it's falling within that acceptance criteria range.
I mean, we can assume that you are as good as RedaCount.
Yes, sir, we are.
Okay, thank you.
Thank you so much for that question, Mr. Ghosh, and thank you so much, Naresh, for answering the questions. Now, I would like to call on stage Dr. Dheeraj Mishra from Mondelez India Foods to kindly do the honors of felicitating our honorable speaker, Mr. Naresh Kumar. Thank you so much, Dr. Dheeraj, for doing the honors. A big round of applause once again, ladies and gentlemen. Mr. Naresh Kumar from bioMérieux South Asia on that wonderful presentation on food safety and quality control through microbiological aspects and predictive approach.